Your relationship with your dental assistant or nurse makes or breaks your entire career. Like, it's that defining. A great nurse is worth their weight in gold.
I think if you work full time, you probably spend more time with your nurse than you do with anybody in your family. And so trying to find the right way of engaging together, I think, is really important. I don't think that my patient necessarily appreciates the 3 different tints I used in their filling or which burr I chose to section their molar, but they absolutely know how they felt during the process. You know, they can feel the energy in the room when they walk in, and that's a reflection of the people in that room.
This relationship between you and the DA is so key to your fulfillment and enjoyment at work that you need to fight for it. You need to think about it. One thing I've adopted in my family life is that you need to run your family like you'd run a small business. And so if you treat the relationship that you do with your nurse like a really important part of your life, that you need to work on it. You can't just show up and expect things to just work out and fall into place. You might get lucky, but have you actually put the time, the thought, the care, the effort into working on this relationship with your DA? This one relationship that you have in the workplace setting, I think personally, as a dentist, can make or break you. Please trust me on this, dentist. I'm not trying to exaggerate or try to make a meal of it here. I genuinely mean this. That a good relationship with your dental assistant, for me personally, is one of the most important things in my dentistry. Why? Because I've been in that situation where I've had a toxic relationship with my dental assistant, and I hated going into work. I worked in a beautiful practice with lovely patients, but because I shared this one little surgery with someone who I felt, and I hate talking bad about other people, but I just felt as though the relationship that we had, we just did not gel. We clashed, and it made it a miserable experience going into work. That's the kind of profound impact your relationship with your dental assistant can have, and I know so many of you are probably nodding your head while driving or jogging, because I think it's more important than which fancy microscope or CBCT machine you have in your clinic. And it's all part of the culture of your practice. It's all part of the values and the team members, and it all goes hand in hand with our theme for this month. This month, we're talking about relationships that support your career. And me personally, yes, the relationship with your boss, your principal, the relationship with your manager, the relationship with your patients, the relationship with your technician. We've talked about all those things before, but this one particular relationship with your dental assistants, I think, trumps them all. And it is with great pleasure that I host today a fellow community member, Dr. Sarah Braun from Australia. She's one of those nice and geeky members that we see on our Protrusive Guidance network, and I love what she had to share. She will introduce us to love languages. Now, hold on, okay? We shouldn't be talking about love when it comes to a dental assistant, but there's a lot of lessons we can learn, because love languages are important when it comes to your significant other and the relationship that you have with them. But there are some lessons we can take from that and apply it into work. We'll share both of our experiences of working in toxic environments and how the relationship that you have with your dental assistant can really impact your work in a good and a bad way. We're going to give you practical tips to help improve the relationship and the workflow, right? It is teamwork. It is the pinnacle of dentistry, in my opinion. And so I know you're going to really enjoy this chat with Sarah, and we actually do share our own tips. I have some tips, Sarah had some tips to share, and valid experiences, and how to handle conflict and how to have those difficult conversations. The important ways that I communicate with my assistants that I work with to help to promote a healthy and good relationship. And this for me has a trickle-down effect to everything that we do, the patient care that we deliver, and our satisfaction at work. So please do enjoy this episode. This interference cast is a non-clinical but super important episode. I hope you share it far and wide, and if you do like what we have to say, don't forget to hit that subscribe button. I'll catch you in the outro. Let's enjoy now with Sarah. Sarah Braun, excited to have a fellow Protrusive on the show today. Always fun to chat with one of our own on a super big topic. It's not veneers, it's not onlays, it's not the sexy little details, but it's the super important thing that allows us to get great job satisfaction. Sarah, I don't know about you, and maybe you've been in this position because you messaged me you DM me on Protrusive Guidance, and I was like, this is something I've been meaning to talk about on the podcast, right? Your relationship with your dental assistant or nurse makes or breaks your entire career. Like, it's that defining. A great nurse is worth their weight in gold. And like, I just want to go deep into this. So Sarah, tell us about yourself from down under.
Yeah, hi, really excited to be here. I am dentist 9 years out. I have recently moved from the city to the country. And so it's been a whole thing trying to find my footing and kind of work out who I am in terms of like a person, but both professionally. And I guess, I always strive to do my best in everything. And I because I really wanted to be, great in the room for both my patients and for my nurse. And I was just really keen to hear if anybody had any good ideas about, how to really kind of maximize that relationship, because I just think it's so important. And I guess when you asked me to have a chat, I thought, look, I've got some things that have been right, but I've done a lot of things that are wrong, and maybe that's really relatable for a lot of people, and that's like a story to tell.
Well, I just wanted to start by saying that, well, firstly, I'm so grateful that you messaged, but me and you, neither of us are experts in like this space of relationship between the dentist and nurse in that regard. Like, we haven't written books on it. We're not authorities on team building or anything. As far as I know, you tell me if you got some sort of certificate I don't know
No,
about,
and I
right?
think that's exactly what makes us like the perfect people to talk about it. We're human.
We are human. We are in the field. We are in the trenches. We've had our fair share of ups and downs with DAs. We've got enough years. We've got more than 20 years between us to talk about this, right? So that's what makes it like cool. Like, and it's like a male perspective and a female perspective, because I think that's going to differ a bit. Classically,
Yeah.
I hear so many times from my female colleagues that they feel, and I don't know if it's like a real thing or not, but they feel that they feel like this, like the older female dental nurse and that younger new associate female nurse. And then because of that kind of, I don't know, some sort of friction or authority battle. And we'll get into that. But you said something interesting, that you come from like a philosophical analysis of this, and me being typical bloke, I'm like, I come with like a practical, okay, here's some solutions I got, tick, 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 tick. So I'm sure we can combine them today, but let's learn a little bit more about you in terms of like, what does Sarah's week look like clinically during the week? What gets you up? What kind of procedures do you like? What kind of practice are you in?
So I'm in a private practice. I am one of 6 dentists. There's 5 chairs. I work 4 days a week, and the day off in the middle of the week I have with my 2-year-old son. And so, it's full time plus 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 at our house. And I actually really love all parts of dentistry. I have been told time and again I need to pick a lane and try and focus on something, but like I love endo, love aesthetic stuff. I love anxious patients. I like I'm trying to kind of teach myself some occlusion stuff. I just bought one of these ones, Dawson's book. And I'm really trying to teach myself to go from a like a single tooth dentist to more of a full mouth dentist. And so I'm kind of going on that journey. And so I'm just like excited by everything.
I love that.
I'm
I
happy
love that
to
about you,
do
Sarah.
everything.
I think that's great. I think one of the key themes I've discussed on the podcast before, especially more in the last year or so, is how I believe that every dentist, every person should redefine themselves every 10 years, right? So like your 10 years at your foundation, now your next 10 years, your identities change. You're a mum now. You're a mum. You're maybe going to be a little bit more focused, and your growth chapters maybe moving away from single tooth dentistry and going more comprehensive. And then the 10 years after that may pivot into a certain subset of that, or maybe you'll take a completely different direction. But I think that's what keeps our profession more fresh and exciting as well. Just
Maybe I'll start a
being
podcast.
open to redefine yourselves. Yeah, please do it. Honestly, let's see how today goes, and maybe so many people. It's funny you mentioned that. Protrusive has given birth to so many different podcasts, right? I remember interviewing James Martin, and back on that podcast, he then created Dentist to Invest. Pav Kaira then made the dental implant one, right? Devang Patel made the Ultimate Dentist. So it's exactly, those are like my little podcast babies, and if it goes that direction, man, I would love that. So Sarah, let's talk about this nurse dilemma. In the States, they call them DAs. What do they call them in Australia?
Yeah, DAs, assistants, that like it all goes. But yeah, DAs a lot. Yeah. What do they call it in the UK?
Yeah. They call them nurses. They call them nurses here. So DAs was a new thing for me. So I'm going to have to work on a title here so I don't isolate like in America and Australia. I thought you'd go for the UK way, right? Nurses, but there we are. You go for DAs. Tell me about your view on how important is the relationship between the dentist and the DA, because it's an obvious one, but let's just start with some context and give maybe some stories. I've certainly got some stories of when I realized this, but anything that you want to start this debate or conversation.
Yeah, sure. So I think the answer is actually twofold. I think that the dentist-nurse relationship matters both for you and your nurse, but I also think it matters for patients. For you and your nurse, I think like as clinicians, we really strive for excellence. We want to work to a high standard. I think that's especially true for anybody who's listening to a dental podcast in their spare time. Um, and I think that, maybe I have an overly optimistic view of people, but I think a lot of nurses also want to work to that high standard. And so in their roles as DAs, their job is to essentially help us perform at a high level, and that will help us grow and develop. And so I think it's incumbent upon us to also help them learn and grow and achieve their professional goals. And so I think it comes down to if we can successfully lay down this framework for mutual empowerment, I think we can also achieve mutual fulfillment. And so, we're both providing each other with the ability to achieve both of our goals of working to a high level. And then hopefully you get to a point where you actually both love coming to work, you enjoy working together, and you can both become a team where you can give everything you have to your patients.
The thing that's immediately reminded me of is the whole concept of engagement at work, right? Engagement at work is so key. There's something called the Gallup polls. You ever come across them?
No, what's that?
Gallup polls like a huge US-based organization and study where they basically, the bread and butter is looking at workplace engagement. And you can imagine that sometimes you may have worked with some nurses or DAs, which they're physically there, but their mind is not there. It could be the same with dentists. It can be anyone, right? It could be a practice manager. It could be a dentist. 87% of the workforce are not engaged. They're disengaged, 1%, right?
Crazy.
Which is
Yeah.
huge, right? Which is huge. So let's apply that. Let's assume that 87% of nurses, 87% of dentists, whoever, are disengaged. For me, it's really important that when I start working with a DA or a nurse, that I kind of get some sort of a pulse from them. I want them to show off their personality. I want them to be comfortable, and I want them to really, a huge metric for me is for them to come into work enjoying it. Now, I don't know if that's a selfish thing, Sarah, because who am I to demand that from my nurse, right? If they literally just want to come in, pay the bills, go home, then this should be allowed to happen if that's what they really want. But I just feel the patient gets the best, you get the best when you can foster that kind of intuitive excitement from a nurse. And for me, I always come in when I work with a new nurse, how can I empower them? You use the word empowerment. How can we empower them to enjoy more, to give more, to take more from that relationship? And I think that's what we want to dissect today.
Yeah. Well, look, I think that having a really great relationship also feeds into, how we treat our patients. I think ultimately we are in the people industry, we are in the service industry, and dentistry just happens to be our means of practice. And so, like, for me, I don't think that my patient necessarily appreciates the 3 different tints I used in their filling or which burr I chose to section their molar, but they absolutely know how they felt during the process. They can feel the energy in the room when they walk in, and that's a reflection of the people in that room. Just the other day, I had a patient who commended my nurse for asking heaps of questions through her CEREC appointment, and she just kept telling us how it was so different to her previous experiences at other clinics. And really, you could tell that our enthusiasm became her enthusiasm, and she just kept talking about how much fun she had had, and she'd sat in the chair for over 2 hours. And, I think at the end of the day, people don't remember necessarily like what you've said, but they remember how you made them feel. And when you have a really awesome relationship between you and your nurse, patients feel that, and that feeds into kind of, all that feedback with how you get patients coming back and what that room feels like.
Imagine you're having like some sort of like heart surgery. Okay, it's something close to home. My oldest son had his adenoids removed, right? And my youngest son is now on the list to get his adenoids removed in 6 months. So can you imagine rocking up somewhere and your son's just been given the gas, they're about to go into GA, and you notice that there's like friction between the anesthetist and the nurse and or the surgeon. Like, that's a scary thing, right? And
Yeah.
for our patients, can you imagine like getting a whiff of, okay, there is this good chemistry here and they're about to work in my mouth? That's actually a very scary thing. So we need to definitely give those kind of vibes that you have with your nurse. Now, have you ever been in a scenario where you've had a toxic relationship with your nurse? Because I have, and even though I was working at this clinic, which a lot of dentists would chop off their left hand to be able to work at such a clinic. I'm actually there now, just by the river, beautiful private practice. And at that practice, I was working with this nurse, and like I'm pretty chill. I get along with virtually all the nurses I ever work with, and I try and bring something to the table. I make them feel valued, and we'll talk about how I do that later on. But I was just not seeing eye to eye with this one. I was just getting like a real toxic relationship between us, and I would go into work miserable during those 3 months. It was really like bad. Someone who's so enthusiastic about dentistry, something who really loves to go into work and deliver dentistry in a beautiful environment that I just always dreamed of working in. Yet because I was in the room with this person who I just did not have a great relationship with, how negatively impacted my mental health was insane. Have you been in such a scenario?
Well, look, I think if you work full time, you probably spend more time with your nurse than you do with anybody in your family. And so trying to find the right way of engaging together, I think is really important. I've probably not had that bad of an experience with somebody, but I definitely have had experiences where I have been called out because I got to a point where I was getting so frustrated. And yeah, that I went through actually a period of time where I tried to do like an end of day chat with my nurse because I just like I wasn't kind of quite getting across what I wanted to, be talking about, and thought maybe if we had like a moment of reflection at the end of the day, maybe that would be really helpful. But it didn't go down well. One of my colleagues called me and said, "Look, your nurse isn't enjoying working with you." And I think, and look, I don't know if this is something that you would have experienced, but it was a lesson to me because something that I hadn't actually acknowledged in that circumstance was the fact that I was, as a dentist, in a position of authority. And that kind of wasn't a space I was comfortable being in. I actually worked as a DA while I was doing my degree. I worked in reception. I did steri. I still do those things. If, people need help, that's fine. But in my mind, I was such a team player. But that wasn't what my nurse was thinking. And I didn't kind of take the time to acknowledge that there's that power imbalance. And so, yeah, I think that there are lots of different reasons why things don't work out. And I think that kind of as dentists, we're not really taught situational management, trying to shift how we deal with our nurses because we're around them all the time. We've learned how to deal differently with different difficult patients with complex things that crop up, but, trying to alter how we are in the room with somebody else, and being mindful that different nurses respond to different things just like we do and when they work with different clinicians. So, yeah, I'm really lucky I've not been in your position though.
But mentioned a very interesting point where you had this experience where for a particular DA, it wasn't enjoyable for them to work with you at that point. That's almost like a really not insulting, but it feels like if for some like me personally, as a personality wise, I would feel that would be like that's crushing. You felt crushed.
Like, I was devastated. I felt so ashamed. Please believe me, I bought her a very extravagant present and a very long note to apologize. Like, it was
Oh, that's
shocking,
sweet.
but it was a huge, learning curve, that, like, you're not always gonna get it right, and your best instinct, like, you can only see things from your perspective, and you don't have all the cards.
Well, for me, when I've been in such a scenario when I'm like being introduced to a brand new DA and we're working together, I really want to establish like some initial, not ground rules, but I want to set the stage for future. And I tell them about myself a bit. I kind of say, hey, this is me. I'm sometimes a bit quirky. I'm sometimes this. Please, any time that you feel like when the patient's gone that we can have a chat and you want to give me some feedback, I'm all ears. I kind of want to disarm any sort of situations from happening from the very, very get-go. I'm very much like at the beginning. And so it's
And does
also
does that
about,
work well for you? Do you get a lot of, do you get a lot of feedback that way?
yeah. Oh, yeah, totally. That's like really well for me. And so one things I do every time I work with a new DA nurse is we have this little induction at the beginning, and I say, look, I want you to be as involved as I am. So I give them examples. Like if I'm doing a composite on a central, I can't see the distal, but if you notice I've missed a spot, just elbow me, tell me, okay? I'll say to the nurse, and it's good to warn them that sometimes I'll do a composite, I'll set the patient up, I'll look at it, and I might invite your opinion, and I ask them, are you comfortable with that? Is that okay with you if I do that? Right. And I kind of get, okay, what level of involvement they want. Because what I'm trying to establish is just like our patients have different personalities, so do our DAs and nurses. And what you don't want is if you're working with a really introverted nurse who perhaps doesn't want to say so much, and you put them in that scenario where they're being involved, that's going to overstimulate them. They're not going to enjoy that. So that initial relationship, you're kind of learning and you want to maybe ask enough questions, just like we do with our patients, to find out what their values are, how they wish to be treated, to make sure that you can actually involve them as much as they want to be involved. And I think that's kind of the initial discovery process that everyone needs to have with their DA.
Yeah, look, I totally agree. I actually do pretty much exactly the same thing as you. I tell my nurses, I don't know what you don't know. So please, tell me when there are things that you want to learn. I'm really lucky at the moment. I've got a really awesome nurse. We have that kind of synergistic relationship at the moment, and she's fresh out of school, and I can tell she just has a fire in her belly. She's so excited to learn. So I actually made her a list of all the different like endo diagnoses and told her, like, look it up. You kind of go through it, learn it. And now, in terms of involvement, I will kind of go through the symptoms and signs and chat to the patient in layman's terms. And then when we are writing the notes together, I'll get her to tell me what the diagnosis is. And she's just so excited to be able to have that level of involvement. So I totally hear you. I think that's a really cool thing to do.
I think in terms of engagement, go back to engagement, how can we keep our nurses more engaged so that they can actually feel like they're contributing and then they're not clock watching? I think the more roles and responsibilities we give them, eventually, it's not like overloading them, it's empowering them. And so one way that we've done it is in the practice I've worked in, if they're radiography trained, let them take the radiographs, right? If they're like, my nurse will take a scan, and that gives me a few golden 5 minutes just to catch up with the notes, collect my thoughts of how I'm going to present the case. And I feel as though they love being involved in that way, doing four-handed dentistry. These are some things that I found that has really helped to make sure that they feel valued, and then they feel like they're making a valued contribution to every case.
Yeah. We kind of do a lot of the same thing in our room. If I've got a nurse who loves taking photos and I can train her with how I like photos, like, please, you take them. Some nurses love writing all my referrals or doing the scans. Yeah, I agree. I totally ask my nurses, what do they want from the day? And, I've been so lucky to work with nurses who are really excited to be involved and, take great pride in that and really, take time outside of work to learn how to be better at those things. I know my nurse last week, she watched a YouTube video of something that we were using that we hadn't used before. And so she's like, oh, so we're going to do this and we're going to use that. I'm like, yes, like that's what I'm doing in my spare time. I love that you are doing it.
And to hear that praise from you, it's they love that so much. That it's really important to give feedback. And I'm very regular with positive reinforcement. So I know it's not my child or anything, but it's important to, when they're doing something good, I say, look, that was really awesome. I really appreciate it. And I'd be very specific when I'm giving feedback. I really appreciated how you changed my instrument from here to here when you realized I was struggling with that. And that really helped me, right? Like, I give a constant feedback like that throughout the day, which I feel as though helps. But I also ask them that, hey, is there a regular check-in to ask them, is there any way that I can change how I do my dentistry to make sure it's better for your back or better for how we work together? Or have you, and I actually empower them. I ask them, is there, if I tell them, if there's something that you do with the other dentists that you spot that the other dentist has nailed something and that you actually wish every other dentist did that, I give them the permission to say, please tell me about it, right? Because so many times I'm doing rubber dam and they tell me later, was like, I wish all the other dentists did it this way because you just made it look really easy. And I was like, how do you feel about having that discussion with that dentist and say, like, can you do it this way? And they're like, no, I wouldn't do that. I wouldn't do that. And they're kind of like biting their tongue, like, because they've seen it all, right? It's like incredibly difficult to be a DA because if you're working with different dentists, to work their different styles is one of the most difficult things ever. So I try and empower them and say that I'm not the finished article. If I can do something better, you have the permission. And I feel as though that's helped a lot. I don't know if you've used that one before.
Well, like,
Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I wanted to do is create a a really supportive environment that's not like the environment we have on Facebook, and it's built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive Guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description, and thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode.
You know, it's the ultimate teamwork, you know, working with nurses, especially who might have like, you know, I was lucky enough to work with somebody who had 40 years experience at my last clinic, and she just like knew how to do things or talk to patients, and I just like learned so much from her, and just like nothing phased her. And so yeah, I think that's yeah.
What do you think about a scenario where there is a toxic relationship, or you're not enjoying it because you feel as though the relationship between you and your DA is very transactional, and there's no rapport, or there's no understanding, and there's a breakdown in the relationship? It sounds like you haven't experienced it to that degree, because you're just so lovely. But anything that you may have experienced with what your principal said, or any advice that you'd like to share in terms of what you've heard other dentists do?
Well, I think when it comes to this kind of question, it kind of just comes down to the fact that you can't control other people. You can't control what other people think and feel. And I think that we kind of need to take the time to reflect and think that, you know, maybe we've got equal, if not more, a part to play in that kind of a situation. You know, I think dentistry is a performance. We are patient or like client facing our 100% of the time. And so we need to learn to manage ourselves and our own emotions when we walk through the door. There are so many stresses that can arise, you know, from complicated procedures, difficult patients, time constraints. Maybe you have KPIs. And so you need to learn how to handle that in real time and with grace. And I think that, you know, ultimately we need to lead by example, and our nurses kind of feed off that. And so, you know, it comes back to trying to work, you know, to those high standards. If you can help put yourselves into a position where you can not be stressed and everything can be calm, and you can help maintain yourself, then hopefully, you know, that impacts the other people in the room.
That was very elegantly said, because, you know, when you have a stressy dentist, now, because I've heard this from nurses, right? When there's an example of a dentist who just like huffs and puffs and gets very like
That
stressy,
was
right?
me.
Yeah. And so it's stressful to work for a dentist like that. Can you put yourself in the position of a DA, right? And sometimes the DA is thinking, is that because I did something wrong? Is it for me? And you get these mixed signals. So I totally love what you said there, that you yourself need to be a model of the type of behavior that, or set the example, right? Have you read the book or listened to the book Let Them by Mel Robbins?
No, I haven't, but I've read, like, psych is kind of, I've always got a psych book open. But yeah, I've been kind of seeing a lot
You
about that.
need to check out Let Them. It is a life-changing book, right? And so, how do we apply it to this scenario? If you're noticed, like, hey, let's talk about, you ask the rubber dam and your nurse rolls her eyes, or your DA rolls her eyes, okay? That's toxic. You can't be dealing with that as a dentist in terms of that kind of attitude, where they like drag themselves, and they like visibly, verbally, they're non-verbally, they're like really annoyed by it, and they're slamming the rubber dam on the table. That's a no-go. So in that scenario, the way you apply the book is let him or her behave in that way. Let them, okay? Let me choose my next step. You have the control now. You have the power now. Don't let the emotions get the better. You have the power. You are fully in control. So in that moment in time, you may decide that, you know what? And every day could be different how you choose to respond. But on that day, you might say, thank you so much. This is really going to help us to get a good result. You do the rubber dam, and at the end, you say, hey, I know it was really annoying that you had to get rubber dam, but honestly, it really means a lot to me. Thank you. Is there any way that we can do it in the future so that it becomes easier for us to work together? Just something like that. Just to, you're not overtly saying, hey, I saw you roll your eyes and I didn't appreciate that. That may be a bit too forward, but try and just get some sort of middle ground. Say, hey, I want to work with you to make your life easier. That's how I see it and how I'm applying the book. But I don't know if you've ever been in that kind of scenario where you've had a nurse that's rolled their eyes.
Well, I think that it's about, I think, having the right expectations as well. I think that if you work with a nurse who's lovely, like 9 days out of 10, and she has one off day, I think it's about taking the time to go, well, hey, they're a human too, and maybe something's going on there, and that's also for us not to take personally. But, I think it's different if somebody's kind of walking into work every day like that. I think that, the way I would probably manage that is to try and kind of go out for lunch and go like, hey, how can we kind of make this work? We've got to spend so much time together. But if someone's kind of lovely all the time and there happens to be a couple of off weeks or a couple of off days, being able to separate yourself from that, just like you're asking your nurse to separate themselves from when you're stressed.
Very good. Now, you mentioned about taking them to lunch, that kind of stuff. Let's talk about this, right? This whole topic of gifting or appeasing or making their day, delighting them, right? Because sometimes you get lucky and you get a nurse that makes you coffee in the morning and wants to delight you, and then you also want to delight them, and that's perfect. That's a beautiful place to be. Like, there's mutual respect there, there's kindness, there's love. That's awesome, right? I remember going to this conference once, and there was like this live panel thing, and then one of these dentists, she said that I am my own clinic, and I value the dentist-nurse relationship so much that every year for Christmas, I'll buy my nurse a handbag, like a really good handbag kind of thing, right? Now, I'm not saying every dentist needs to do this, but it makes you think about how are you showing your nurse how much you value them. And it doesn't have to be expensive. It can be in small gestures, politeness, kindness, or finding out what it is that they need to feel fulfilled. Any examples of how you like to delight your nurses, DAs in the past, and what works?
Yeah, I think it kind of depends on like the whole love languages thing.
I was just going to say that. Okay, tell everyone who doesn't know what love language is, because that might sound a little bit fishy when we talk about the dentist-nurse relationship.
Okay, so love languages is basically the idea that we all kind of expect to give and receive love in different ways. And so they are acts of service, or doing something nice and thoughtful, quality
That's my wife.
time, quality time, gift giving, words of affirmation, and I hope we're not giving too much physical touch to our nurses. Physical touch.
Yes.
And so I think it's kind of learning. The idea is to learn, how do you feel most loved? And I guess the way I kind of understood that was, if one of those things was absent, what one would you really feel? And then also kind of for your nurse, and finding something that is appropriate, because you might make them a cup of coffee and they don't care. But you might really kind of, appreciate that. So I think it's kind of trying to work out, where do they sit, what works for them, what works for you. Yeah. And
there's no shortcut
me,
to that, right? It just takes time and for you to figure out and suss out each other. Sometimes it's easy. The chemistry's there from day one. You just suss it out, and you know you got a nice flow with them. But I would say, like, okay, since we're talking about relationships and love and love language and that kind of stuff and all that good stuff,
Let's get into it.
let's just talk about it, right? And obviously, I don't want anyone to take this the wrong way about your DAs and that kind of stuff. Please, everything in a strictly professional relationship. But what we mean to say is, love is a verb. It's not just a feeling, it's a verb, right? To love, right? So I always say to my friends and say to myself during relationship ups and downs, you always say, look, are you keeping your end of the bargain? Are you verbalizing? Are you actually giving the love in terms of not just it's a feeling, it's actually, are you doing something for the other half? Are you showing that, right? So in the same way, extrapolated and diluted for this professional relationship of working with your DA, which, like you said, you might spend more time with them than you do your spouse. Most of us do, and that's the reality of it. We need to give it a shot. This relationship between you and the DA is so key to your fulfillment, enjoyment at work, that you need to fight for it. You need to think about it. One thing I've adopted in my family life is that you need to run your family like you run a small business. And so if you treat the relationship that you do with your nurse like a really important part of your life, that you need to work on it. You can't just show up and expect things to just work out and fall into place. You might get lucky, but have you actually put the time, the thought, the care, the effort into working on this relationship with your DA?
Yeah, I totally agree. I think it's trying to find, how do you communicate effectively between each other? How do you give and receive feedback well? How do you show and receive appreciation? I think that yeah, like praise is an awesome thing. I'm often telling my nurse, I love the question you just asked. It really shows me that you're kind of thinking about things. I often will bring kind of leftover food that I know that she's not getting the same home cooked meal. And so I often will bring that. She was to be hungover the other week, and so I picked her up to work and then dropped her home. I think that for some people, it's about feeling like a part of something bigger than themselves. And so I found, some nurses really kind of want to feel that like they're in the fold. Other nurses, yeah, sure, appreciate, just gifts. But, I've been lucky enough to become pretty good friends with most of my nurses, and that's a whole other thing, trying to kind of straddle that boundary. But
I think it's easier for female dentists. I feel, Sarah, that's easier for a female dentist to be a friend with their female nurse, right? Let's say, okay, about 90% a female nurse, right? So here's the curveball, right? Some people would argue that there's a line that you shouldn't cross. So basically, if you're the boss, if you're the principal, your associates and your nurses, your team members, you'd be polite to them, you'd be courteous, but you have to keep this like little barrier distance that respects that relationship, that they are not your best friend, right? That you don't get into the friend territory with the people that work for you. And I don't know if you've thought about it in that way. Like, is it perhaps a dangerous thing or a unprofessional thing to cross the boundary into mates? And I'm saying that as someone's got pretty much a very friendly relationship with all my nurses I've had. Zoe, I used to call Zoe my work wife. We were chill. We would have a great time. I miss you, Zoe. Hope you're well. Lorna, who I have now, it's this bubbly beacon of positivity, and we're mates, right? And so I get that, but I sometimes think that should we not be? Should I keep this frame of professionalism and be like, no, we're not going to have coffee together. You go, and I'm the dentist, you're the nurse. And we're good, we're on good terms, but we shouldn't cross that invisible line. That's philosophical for you.
I'm happy to blur that line to hell. Yeah, that's fine for me. Look, I think it comes with its own suite of problems. I think that, you're at risk of people taking liberties, both like in the room and out of the room, for sure. That kind of closeness translates into, I think, a really awesome working relationship. And, crazy Christmas parties I've had with people like has kind of translated into awesome like months of work, because we've got this kind of bond there. And look, that works for me, and that works for the places I've worked at. It doesn't work for everyone.
Works for place, but it has to work for the DA as well. Like, you both need to say eye to eye. I need to kind of suss out. Yeah. You need to suss out, is this individual of that kind of nature that they would value coming into work more? Like, so one of the things in the Gallup poll was, do you have a best friend at work? I'm not saying you have to be the DA's best friend, but I'm saying when you lose a best friend at work and they move on somewhere, the chance of that employee leaving in the next 5 years is like stratospherical. It's huge. So having that friend connection at work, it is an important aspect for engagement at work, actually.
Yeah, I would totally agree. I mean, yeah, I think it's tricky, but I would rather navigate that trickiness than try and navigate kind of, ooh, how much distance do I keep? Like that's not that for me. I'm kind of once, we're mates, like I treat everyone like family, and that's just like that's who I am.
Well, that's you.
But
That's
yeah,
you. And what I love about that, Sarah, is that I'm a big believer in showing up to work and being your authentic self and being able to be your authentic self and being able to show your authentic self to your patients with a professional frame, but patients will over time be a reflection of who you are. Right. So I'm,
absolutely.
and that's true. And therefore, if it works for you, and this is advice, if it works for you to have this kind of relationship where you can be like friendly with your DA and it works for DA and their personality type, then fine. Just always make sure no one's taking the piss. But equally, if it doesn't work for you and you're not that type, then respect that. You don't have to then be best friends. Just be courteous and polite and respectful. And I think there's a middle ground somewhere, and you need to identify where you belong in the universe in that kind of space.
Yeah, absolutely. And I think when it comes back to like the whole love languages thing, regardless of like how much you are mates or not, showing your appreciation and being grateful. I mean, if we're spending all this time trying to be awesome at what we do, and then at least for me, I tend to hope that my nurse is also having those same goals. And so if she's showing up with like a smile on her face and she's just watched her YouTube videos in her spare time and she's coming in early to, help set up for the day, and not getting paid for that stuff, I want to show appreciation for that in a way that she will kind of acknowledge and mean something.
Wrapping up now, Sarah, I've enjoyed this chat very much. New grads, right? That's like they're not used to, like sometimes we're like doing the suction for each other at dental school, and then finally you have a nurse, you got a DA on your hands, and then it's it's like overwhelming. You got this patient with problems, and you're like trying to piece together everything you learned at dental school to actually be able to come up with a solution. You're second guessing yourself, you're questioning yourself, you're learning about so much the whole time. It's like overstimulation, and you got this whole other person, your DA, to help with, to manage, to grow with. What advice would you give to young dentists that will help them to foster a good, healthy relationship with their DA so that ultimately you can give better care and have more fun at work and show up as your best self?
I think there are like a few small things I think you can do, just like very practical level, that I think has been, at least for me, like super helpful, because I've gone from having more difficult relationships to things getting better. I think kind of like a keystone habit is having really good time management. That means kind of getting in early, going through the day together and like looking at what's coming up so that you can both be organized and preempt stuff. I think nailing your treatment planning, knowing how long things are going to take you, and therefore, you're respecting the time that you need, you're respecting your patient's time, and you're respecting your nurse's time as well. I think getting them out on their lunch break and finishing at the end of the day is like what
I'm
we
so glad you
should be
mentioned that.
doing.
It's huge. So that's
Yeah.
absolutely monumental, and I think it's disrespectful. Yeah, you one day out of every couple of weeks it might happen a difficult extraction, and nurses get that. That we're in healthcare, they get that. But if you repeatedly violate it because you don't book enough time, because you don't want to charge enough or whatever, like whatever reason you have, then that's a real red flag, and that's on you. And so you need to allow, like, that time is sacred for an employee, and you need to really respect that. And if you do
Yeah.
run late, apologize. I think that's okay. There's nothing wrong with saying, "Look, I'm really sorry I kept you waiting," and they really like that. Oh, that's okay, kind of thing. They appreciate that you've been thoughtful enough to mention it.
Yeah. And I also think taking the time to reflect, why did you run late? Did you plan the same amount of time for a DO on a patient who hadn't been there for 20 years and has got mad perio and is just like, you're about to do a pulp cap? Like, you should have known that. You could have known that before going in. That's about kind of learning to nail your time management and like preempting things. And so I think that that's a huge thing. But I think ultimately, in terms of having that really nice relationship, getting to know each other, being vulnerable with them, telling them what things cause you stress, what things do you get worried about, giving them the space to tell you what things they get worried about. I had a nurse who didn't deal well with a lot of blood, so she had to excuse herself from all my extractions, which, like, thank you for telling me before the extraction. That was so helpful. But
Very good.
ultimately, leading by example, trying to kind of manage your time, manage your stress, Yeah, that will just help kind of feed back into the energy of the room.
The only one I want to add on to that, was that all of them for yours, Sarah? They were wonderful.
I think that's it.
Right. So the one I want to add, and this is personal to me, but I feel as though I think DAs really appreciate this, Sarah, because I love learning, right? So one of my 5 strengths from Strengths Finder 2.0 book, which I recommend to everyone, is learner. That's like my second top strength, right? Learner. And the highest taxonomy of learning is teaching. When you're teaching something, that's the highest form of learning. So I've always had that. I've always been like teaching, tuitioning, mentoring, that kind of stuff. And no wonder I fell into the space I'm in. I also adopt the same when I'm doing my dentistry. Now, for 2 reasons. I'll be doing like my rubber dam, and I'll be inverting the rubber dam. And I'll actually be like twofolds, okay? One is I'm doing the inversion of the rubber dam. I'm telling them, hey, this next bit here, can you blow some air here? Okay, great. I then get my flat plastic, I'm inverting the rubber dam, and I say, can you see the difference? Now what I'm doing is I've tucked it into the gingival crevice. There's going to be a much better seal, okay? Now, whether they've heard this 1 time or 1,000,000 times, it's okay. But that's like something I tell them beforehand that, hey, I will be teaching you some things. I'll be showing you some things. Some of it's for you. Some of it is for the patient, for them to get value from the appointment. And so they get that. And actually, what I found is that my nurses have always really enjoyed what they're learning with me. They're like, finally, someone's explained this to me. Oh, I never knew why you did this for the last 20 years. Now it makes sense. And now that I've been like video recording like 90% of my procedures, and like the laptop's behind me, my loop camera's on, and now the nurse is like looking at the video and doing it. And she's like, wow, so that's what you guys see in your matrix. All I'm ever seeing is like the tongue. And so they've loved having this level of insight, which is great. And I just feel this education heuristic has really helped me in terms of like, hey, this is why we do that. And did you know that this, I aerobraid because it improves, removes biofilm compared to that, and just give little facts, which is benefiting the patient because like, oh, wow, this guy sounds like he knows what he's doing. I like this guy. And 2, the nurses are learning something, which I think is a great bonus. And that's something that always has worked for me, and it might work for those listening out there.
Yeah, I actually asked my nurse before coming on, I asked her, we've got a great relationship, what has really helped her kind of, in establishing that. And she kind of said, explanations. She's just so excited to understand why we do things in a particular way. It gets her excited to be able to think about what's happening and being able to preempt that. I've taught her forehand dentistry, and so she's just so excited to be able to kind of be, in it and amongst it and to understand what's going on. So I totally agree with you. I think that works, again, in my experience, for a lot of nurses, not for everyone, but in terms of getting that engagement, explanations is awesome.
Explanations and the philosophy that I follow, which is show you're working out. So like anything like, don't give the answer. I show them. So this is why I think, this is why I think what I think. I actually apply this to patients. Every treatment plan I do, I give them the treatment plan, but I say, okay, I came to this decision based on this, and this fact, and your goal was this, but your modifying factor is this, and therefore this is my treatment plan for you. That's my working out. And I apply this to my nurses and to my patients. So Sarah, thank you so much. I'm so glad that we got to record something so as wholesome as this. I think it's a really wholesome episode. I think it's going to help a lot of people. It'll give them ideas. Now, there may be people screaming on Spotify and Apple saying, what the hell? No, do not become best friends with your nurse. And that's fine. Okay, come on, Protrusive Guidance. Let's have a little healthy debate. It's okay. Let's have a chat about it. But I think your nurse must love you, Sarah. Your DAs must absolutely love you. You must be an absolute pleasure to work for. And if people take away a few little tidbits and advice from today's episode that will improve their relationship with their DA and therefore their fulfillment in life and work, then I think we have done a good job.
If anyone can, if it can help anybody, through a tough spot, I am really glad to help.
Well, you're on Protrusive Guidance, so you can always DM Sarah Braun. Any other ways that we can reach out to you, send our thanks and discussions and debates and hate mail about being friends with your nurse and that kind of stuff?
To be honest, I'm trying to detox from social media, so not really. That's it.
All right. Okay. Don't you dare reach out to Sarah. No, so I appreciate your time. Honestly, thank you so much. Okay. You're an absolute gem, and I'm so glad you're part of the community. Thank you.
Thanks, Jazz. It was great.
Well, there we have it, guys. Thank you so much for listening to this episode about a really key relationship, the one that you have with your dental assistant. Wasn't Sarah so lovely and so great? Sarah from Down Under, we love you. Thank you so much for making this episode absolutely brilliant. Now, because this episode was about teamwork, it is eligible for CPD and CE credits. We are a PACE approved education provider. So for those premium members on the app, scroll down, answer the quiz, and our CPD queen Marie will send you your certificate. The CPD is one reason to join the subscription on the app, but you join for the education, but you stay for the community members, just like Sarah. We're very lucky, you can use the word lucky, but it's by design that we've attracted the nicest and geekiest dentists from all around the world. And I'd love for you, if you identify yourself as nice and geeky, please do join us. Head over to protrusive.app, make an account, and then you can use the iOS or Android app, and you can use your login credentials on there. On the app, you'll find all our premium notes and all the summaries of this episode and all the episodes we've had. One of the best places we have on there is called the Protrusive Vault. It's just so rich in PDFs, infographics, protocols, anything that we find good and share worthy. And also recently we had the consent form exchange. We borrowed everyone's consent forms and they're now available for you to download and contribute to as well. So much goodness waiting for you on the app. So check it out. And don't forget, if you really love this episode, share it with someone. Share it with someone, and that's how our podcast grows and we're able to make more content like this. I want to thank Team Protrusive for all the hard work behind the scenes, and thank you for tuning in all the way to the end once again. I'll catch you same time, same place next week. Bye for now.